Hey, welcome to my channel. My name is Alexandria. I'm a registered nurse and a freelance health content writer. And in this video, I'm going to be talking about the differences between health content writing and medical writing. If you like what you hear, please subscribe to this channel. Okay, so before I even get started talking about the different types of content writing, first you always have to remember, or keep in mind at least, that journalism really is at the forefront of content writing. And journalism is really just a dissemination of information at its core. So how do we get that information? Most people go through media, whether it's TV or radio or newspaper, or they follow a podcast. Other people might use other avenues like word of mouth to get their information. Health content writing and medical writing, you can really kind of differentiate those by the type of audience, the target audience for those. So when we think about health content, I know in a previous video I've mentioned that I have asthma. So for example, if I'm going out and I didn't have a background in nursing or any experience with asthma, I may turn to the Google search engine and just type in the term asthma, and 9 times out of 10 there's going to be a list of articles that pop up. Places like WebMD, Harvard Health, Everyday Health, maybe even Medscape will probably have an article on asthma, and they'll cover your very basic things, or your most general stuff. What is asthma? What are the signs and symptoms? What are the causes and risk factors? How do we diagnose it? How do we treat it? How do you live with it? What is the prognosis? All of that falls under health content. Health content writing really is targeting that everyday consumer who's looking for more information about anything. It just so happens that when we're talking about health content, usually the consumer is looking for content related to health. Now, that could be other things related, like beyond a medical condition, like how to lose 10 pounds, or how to lower cholesterol, or how to manage caregiver burnout. These are all things that fall under that health content umbrella that typically people are writing about. Now, anyone can write health content. That's the gist of it. Most people have a background in journalism, but other people might have a background in nursing, in science, in physical therapy, in nutrition, or they might be a physician. It really just depends on the type of content that you're writing and who the target audience is and how well you can speak to that content. So even if you don't have a background in healthcare, maybe you have a large experience or a vast amount of experience in something like asthma or in something like caregiver burnout. And then as it relates to medical writing, the audience typically is your physicians and your scientists and researchers, because medical writing really is dealing with the newer information that's coming out about a specific condition or about a new technology, a medical technology or advance in technology, or some new investigative drug that's coming out. It's really targeted towards your medical providers, your scientists and researchers, or people like myself who are really just kind of nerds and really interested in keeping up with the latest scientific evidence. Now, medical writing, typically people who write in the medical writing space have some type of background in journalism, or they might have gone to school or gone to through a certain program to become a medical writer, because medical writing can be a little bit more technical, especially given the target audience, right? Your physicians and your scientists and researchers and other nurses or healthcare professionals who are looking at that content, they don't really need a breakdown from the medical jargon. They want the up-to-date information. They want the what's new, the what don't I know, what have I not read in a textbook or learned through my direct patient experience or direct patient care. So that is the gist in terms of the differences between those two, medical writing and health content writing. If you like what you've heard, please subscribe to this channel.